Blayke's a normal 4-year-old. She's rambunctious, she's wild, she's fun, she absolutely loves her sisters. But overall, Blayke, to the everyday person or most of the people that know her, don't realize that she has Dravet syndrome.
She could be having the best moment of her life and then a seizure could start.
Dravet syndrome is something we've known about for a long time in general, but more and more in specific recently. In this current era, we were able to find that it is largely due to a difference in one particular gene, which codes for part of a neuron in your brain that helps your cells in your brain talk to each other. And when they're not functioning properly in this way, they can cause many brain problems, including developmental differences and seizures. And with that knowledge, we've come to understand a lot more about how to help children with the condition with new therapies, and particularly targeted therapies that look right at the cause of the condition.
You know, when we were early on in Blayke's journey, we were probably about 7 months into it. We took her to the beach. It was me and my 4 girls, and within 10 minutes, Blayke had a seizure. And we couldn't get the seizure to stop with the rescue meds, and the medics couldn't get the seizure to stop either. A very scary and humbling moment when you're watching your 18-month-old be intubated and life-flighted back from the beach to Doernbecher. She had probably seized for over 2 hours in total. It was probably one of the worst days of our life. Blayke takes medication 3 times a day, morning and around 3 o'clock, and then in the evening time. Right now she's on 3 different medications. And the one thing about Blayke's situation too is that it's really medication resistant. In her 3 years in this journey, she's probably been on 8 different medications. So,
you know, I think there's so many ways that epilepsy can affect a family. Kids with Dravet syndrome are prone to having long seizures that may require emergency care. And so being kind of off the grid is really difficult if you're a parent of a child or caregiver of a child with Dravet syndrome. We are the only center at Doernbecher, at OHSU, in the state of Oregon that has pediatric neurologists that are epilepsy subspecialists. Our Doernbecher program is really organized well to address the needs of someone like Blayke. So Blayke is amazing. Seeing her every time in clinic with a huge smile on her face, run around, be happy, it's just inspiring seeing kids like her and knowing what they deal with, knowing that they deal with frequent seizures that don't make them feel good.
Her resilience and spirit inspire me every single day. You know, many parents of children with Dravet syndrome or epilepsy reference their children as warriors, and I mean, Blayke speaks to that wholeheartedly. I mean, she's been stuck in hospital rooms and has, you know, done remarkably well in those settings. She's just such a bright light in everybody's world. She is legit referenced as everybody's baby amongst our family because she's everybody's baby and is so loved.
It was very, very confusing at the beginning. It's scary. We didn't understand what it was. Being able to be now a part of that team and understand the importance of those resources is priceless from our point of view.
What's a really important difference right now is that many of the therapies we're looking at are not just treatments that help minimize the symptoms of a condition, but what we call disease-modifying therapies, things that actually go and address the underlying cause of the condition and seek to change that so the condition itself changes and may even go away. That's a tremendous thing which we've never been able to do before in the ways that we have, and seeing that begin to happen for Dravet syndrome and for some other conditions like Dravet is a tremendously inspiring thing. And it's been very exciting for me to be part of that, and I look forward to continuing to grow that. Right now, one of the main reasons we are seeking philanthropic support is to grow our educational mission. We would like to begin a variety of different teaching opportunities and endeavors, including a Pediatric Epilepsy Fellowship to train people to do exactly what we do here in Oregon. There'll be a fantastic opportunity for people to learn about how to do what we do. It's not an easy thing to do, but we really seek to help not just our patients, but their families across this journey.
I just think the number of families it's going to help is endless. we're helping the syndrome. We're helping kids that don't have it yet. We're helping kids that aren't born yet. And one of the things that excites us about this is the ability to kind of build in a bullpen, for lack of a better term, of other doctors, to attract other doctors to follow in the footsteps of Dr. Bushland and Dr. Roberts, and to be able to just provide more access to more kids. And yeah, selfishly speaking, to be able to give Blayke a better shot and a better opportunity at living a normal and fruitful life. The ask for us is, how do we raise enough money so that OHSU can either put together an educational program through the university, or even better yet, to be able to hire through a fellowship program a doctor that could follow in the footsteps of the doctors that Blayke has now. And we're told that, that can range, depending on the level of care, anywhere from $1 to $2 million, possibly even up to $3 million. So anything that can help get us to one of those goals, because every resource that is added to that team is just going to help more kids. And thank you to everybody who, the family, the meal trains, to the neighbors, Karen, Shauna, my mom, Kirsten's sisters. The list is long. And our daughters, I hope someday that they'll look back at this and they realize how strong and tough they are and how much of a help they are. And they are the best 3 big sisters we could ever ask for. And
I think it's also important to thank, my Ted and Ruthie Dodge, which are my parents, my mom and my stepdad. They have moved this idea to an official endowment, which makes it the Blayke Gloeckner Endowment, through their incredibly generous donation. That is really the launch pad to be able to be here today and to be able to continue to work with the OHSU Foundation, Dr. Roberts and Dr. Bushland at Doernbecher, to really see the possibility of this coming to light. So thank you to them, and thank you to any and all of you that are willing and able to help us out with this.